Doctor, I'd like to ask you a little bit about, when you take a look at the cases you can handle, why would I come to your practice? What skill set do you have to offer that maybe another dentist who does do implant dentistry? Tell me a little bit about that.
Well, the difference is that I understand not only the surgical component of it, I understand the restorative component of it. I understand how important it is for the teeth to be aligned so patients can speak better. How important to the teeth to be aligned so the lip can be properly supported, right? Have you ever seen a patient with no teeth? It seems like their front mouth is pretty much caved in, right? So the surgery is one aspect of it, right? And you can teach someone surgery, right? But you can't teach them to think beyond the surgical aspect of what we're doing, right? So working side by side with some of the prosthodontists that are specializing into making sure that all of these components are working harmoniously to give the patients what they want. 2,000 plus cases will allow you to be able to look at a patient and say, you need this, you need that, you need this, and this is what's going to work, right? Versus this unpredictable saying, I don't know if this will work, maybe that will work. No, you're coming to me because I have the expertise and I have the knowledge to say, this is what you need and this is how we're going to get there, right? And so not only just saying, this is what I'm going to do, I'm going to say, what if something happens? And I will say, this is what we'll do to fix that, right? Wow. So it's not just doing it, it's being able to handle what's going on during the time that you're treating, or if there's any complications that come after it, I'm well capable of managing that as well.
I've heard of dentists that can restore implants, but they can't do implants. And maybe you could tell me what that means, because you have all these different choices. Yeah. And some dentists you go to for implants, but you have to go to a different office to get the implant, and then you come back to, is that the case with your practice?
No. Sometimes we get referrals in from general dentists who just want the surgical component done, and that's okay, that's good. We provide that service to those patients.
So that's a surgical component, it's the implant.
It's the implant. Whether it's implant, whether it's some other surgery that they need on top of the implant surgery, we are happy to provide that service. Some patients are just sent to us by the general dentist and they say, I don't know what to do with this patient, you need to work this up for me. Right? You need to go through the treatment steps with this patient and help me help them as well.
Which is the right thing to do, especially if you're a general dentist and this is out of your skill set.
Absolutely.
That's the appropriate and ethical thing to do.
Absolutely.
So then restoring a dental implant as opposed to placing it, what's the difference?
Well, the difference is there are two different steps.
Okay.
Right? There's the surgery component, which is I place the implant.
Okay.
And then there's a part where the tooth has to be connected to the implant. I have colleagues that are in the office to help with that process. Gotcha. Because I'm a surgeon. And so do I understand the restorative aspect where the teeth are supposed to be positioned? Absolutely.
Of course you must.
Right? But again, we have trained experts who focus specifically in that area. Right? So although I know how to do it, I put you into the hands of someone else who actually who are experts in that, who study this.
But under your roof?
Under my roof.
So if I come to you, I don't need to be referred out to another?
No.
Gotcha. No. I think that means a lot for people.
Yeah, it's convenient. It's kind of like going to the mall.
Well, when you find somebody that I think, dentistry is kind of a personal thing. It at least is for me. Mm-hmm. I don't want to, I like my dentist. I don't want to go to somebody else if I need something else done. So
that's that. I mean, it's similar like going to a mall, right? You go into a shopping center. There is clothing stores, there's shoe stores, there's stores for electronics, there's a food court, right? So we utilize that same approach. When you come here, we have everything that you actually need.